your pelvic floor feels tight, it feels weak, or uncoordinated, there is a very simple 3-step solution or approach to solve the issue. I have done several videos about pelvic floor dysfunction, how it's created, what are some of the telltale signs of pelvic floor dysfunction, some of the obvious ones and not so obvious ones, how it can impact men and women, and it has nothing to do with lack of medication, improper strengthening exercises, or lack of stretching exercises. Pay attention to that. That was a good one. That was a loaded statement here. In this video, I'm going to break this down, the things that you can do to restore your pelvic floor function in 3 simple areas of the body that impact it. The number 1 step in solving the issues related to weakness, tightness, or lack of coordination is biological breathing. If you had subscribed to my channel, you most likely know what biological breathing is. If you have not subscribed, make sure you do. We'll make sure we put it at the end of this video. Biological breathing is nature's way of trying to condition the muscles inside your pelvis, not just the floor, the whole pelvis. In proper breathing in, biological breathing in, you relax these muscles, and when it's time to breathe out, you contract those muscles. So at a frequency of every breath, you're conditioning these muscles, and the reason for that is because the pelvis needs to be as stable and solid as possible, because the structure above relies on its stability. So biological breathing has to be in place in order for you to have a chance to make progress. The second thing we want to address is trunk stability. When you're being developed in your mother's womb, your trunk was created before your extremities. When you are born after biological breathing, which should happen for the rest of our lives, trunk stability is how you develop stability going forward. So you first stabilize the trunk. Now, where is your trunk? Your trunk is that part of your body that is covered by gymnastic leotard. So this is not a strap leotard, that's the sleeveless shirt leotard. So your pelvis part of your trunk. Your trunk is your core. This is not your core. Your core is your trunk, the part that's covered by the gymnastic leotard. So trunk stability has to take place and has to exist, and your trunk movement is absolutely critical in your chance of stabilizing and keeping a stabilized pelvis in place. Now we need to look at upper and lower extremities. That means the connection, the ball and socket joint of your hip joint to the pelvis needs to be solid. So that means when it comes to pelvic floor dysfunction, just going to the pelvis or going to the area where the symptoms come to the surface and trying to address or dampen the pain there, expecting for the stability to be there, is an absolute dream. It's not going to happen. So you may be injecting that nerve that's speaking up. You may be putting a stent in that blood vessel that is being pressured on and malfunctioning. You may be Botoxing the muscle that's tight. That's not going to materialize the result you want, because you did not address why that nerve became irritated, why that artery was collapsed or vein was collapsed, and why that muscle was tight. So how do we go about stabilizing the pelvis with biological breathing done? And now we need to stabilize the trunk and the lower extremities. I use developmental exercises to do that. Developmental exercises are the same series of movements that you and I and everyone around you that walks does, or did, I should say, to become a running toddler. We all followed the same steps without even knowing. No one told us what to do. We didn't go to a gym. We didn't lift a pound of weight. We didn't use any straps or bands, and yet we all became running toddlers. That's a dead giveaway that is the way to stabilize and to coordinate our movements. Why are we doing anything else? It just does not make sense. If we're all doing it and our brains programmed to do it, and we all did it at some point in our life, and then we dropped the ball, shouldn't we just go back to the same thing and make sure this time we don't drop the ball? It just makes sense, doesn't it? So the 3 steps to restore the function of your pelvis are the 3 steps you did as a newborn to become stabilized, to become balanced, to have coordinated movement to begin with. So I'm going to show you just a few examples, short of biological breathing, which we're going to put at the end of this video, to just let you know what they look like. They look simple, and yet you may find it difficult to do correctly. When you're doing developmental exercises, you are committing to the principles of movement and applying those principles across all activities, not just during the exercises. The principles are the principles for the rest of your life. That's kind of like the principles of driving. At what point do you stop following them? At what point, after how many years of driving, is it okay for you to pass a red light? You get the point here, right? So, biological breathing, that's the first one. The next one that we're going to do, I think it looks like I have toe tapping. So, one of the principles that need to be in place is neutral spine. Neutral spine does not mean that you lose the curvature for good. That just means you learn to stabilize the curvature in the lower back by breathing biologically, because that's when you increase your chances of actually stabilizing it. So you're going to be laying down on your back, closing the gap in the small of your back. So if it's lifted up like mine is now, you're going to rotate your pelvis to close that gap and keep that gap closed. That's trunk stability. And now we're going to do stuff with the lower extremity. Bring one leg up, keep that gap closed, and bring the other leg up. So right now, my trunk is learning to do its stability. The front and back body and my breathing are helping in trunk stability. As this is stabilizing itself, now I'm giving a task of tapping the ground and coming back up. So my legs get to do legs' job as my trunk maintains that stability. I need to be able to do this so much that when the time comes and I'm on my feet, I can continue stabilizing my pelvis, so the connection of my spine to my pelvis is nice and solid, so my lower extremities can do the leg work, so the connection of the legs to the spine is nice and solid as well. Now the next thing, and by the way, you do this as a 3-month-old baby. The next thing, 3 to 6 months old. The next thing that we're going to do is we're going to still work on trunk stability. We're going to bring our obliques, your abdominal muscles, start from back here. They're not just in the front. They start from back here, covering the top of your pelvis and the lower part of your rib cage, and they go all the way to the front rim of your pelvis and up to your sternum. So now this exercise, which is side to side movement, not initiated by the legs going to then take your trunk, because that means now my lower extremity is telling my trunk what to do, which is not how the principle of movement is. So I'm activating my obliques to rotate me. What matters is for my obliques to work together and activate the movement. It is not this movement that is going to materialize strength. It is you repeating the side to side move that allows your body parts to know exactly how to coordinate the movement, how to work on the timing, etc. I'm going to now show you a very, very important exercise that involves your serratus anterior, which is so important for the management of your rib cage positioning and your shoulder blade positioning. It's one of those exercises that in my practice, I find it to be very, very much not used. So in this exercise, you're going to lay down once again. The small of your back is closed, your legs are lifted, and you already practiced for 3 months. You've been practicing this side to side. And now more than 3 months, actually, more like 4 months, maybe 3, somewhere between 2 to 4 months. Your arm is extended, and I'm going to tilt at the same time, activate my serratus so the top right under my armpit is lifted up. I'm not lifting it up because the top of my body is pulling it up that way. I'm lifting it up because I'm activating my serratus to lift me up. So it's relax, activation. Now it's time to go back. I'm going to press on the floor and return as one piece. I did not use the top leg to go up and take me back. I'm moving as one unit. This is how you lay foundation, how you practice the mechanics of movement, and by repeating it, you're training your body parts to recognize each other, to learn how to work together, and by repetition, it becomes more of you. When that happens, when you follow developmental exercises, all different parts of your body are properly being activated. So your serratus anterior is activated. So you will not find yourself in this position because you're breathing biologically. Your serratus anterior is also helping you in managing your trunk. Your neck muscles are understanding how to move and beyond. I just showed you 3 exercises that were important for trunk stability. There's a lot more there. So make sure you subscribe to my channel. Make sure you visit my YouTube channel and you understand what these exercises are. If you're ready to learn and to apply and to learn what your default tendencies are and how to replace them with proper movements, make sure you contact me and we can chat first and make sure that you are in the right place. Thanks for watching.